Well, tonight, these are the two big numbers when it comes to COVID-19. The Ohio Department of Health reported more than 15,000 new cases today and a positivity rate of nearly 25%. Now, these are some of the highest numbers we've seen in the COVID-19 pandemic at all. And there is a thought that the numbers may be even higher than that. Good evening and thanks for joining us tonight at 11. I'm Yolanda Harris. Andrew has the night off. New at 11 tonight, 10 TV's Olivia Eugenio spoke with one doctor who says 15,000 cases should be even more.
The Omicron variant is on fire in our state.
As the Omicron variant continues to spread, many are turning to home testing. But Dr. Joseph Gastaldo from OhioHealth expects not everyone is reporting their results.
If you read the fine print, home antigen tests are supposed to be reported to the local health department, so that gets counted in the daily positivity reports.
So the number of cases being reported is actually lower.
I would say anywhere from 5 to 10% lower than what they really are.
PCR tests are required to be reported to your local and state health department. And that's not all that Dr. Gastaldo says could be contributing to lower numbers.
What we are seeing because of either barriers to get a PCR test or the lack of access to home antigen tests, there are people who are probably symptomatic, who have an infection, who are not getting tested.
Dr. Gastaldo also says it's important to know the difference between the different types of COVID testing and what they tell you.
When you have a home antigen test, it lets you know if you are contagious. The other form of testing that we have is PCR testing. PCR testing is more sensitive. However, you can be PCR positive without being transmissible or contagious. That's not true with home antigen tests.
Olivia Eugenio, 10 TV News.
Dr. Gastaldo says it is important to report your results from your home test to your local health department because knowing when you test positive will help determine when cases might peak.